This is going to be a video about Ritalin, also known as methylphenidate. Ritalin is a class 2 drug that is taken by tablet orally, preferably 30 to 45 minutes before eating. The dosage of Ritalin varies depending on the patient, but the average dose is usually 20 to 30 milligrams per day, and that dose is spread throughout 2 to 3 different tablets. Indications for taking Ritalin. Ritalin is a central nervous system stimulant used to treat ADHD. Ritalin may also help increase the attention and decrease impulsiveness and hyperactivity in patients with ADHD. Ritalin should be used as part of a total treatment program for ADHD that may include counseling or other therapies. And Ritalin can also be used in the treatment of a sleep disorder called narcolepsy. Precautions and contraindications. Ritalin should not be taken if you or your child are very anxious, tense, or agitated, have an eye problem called glaucoma, have tics or Tourette syndrome or a family history of Tourette syndrome, or are taking or have taken within the past 14 days an antidepressant medicine called a monoamine oxidase inhibitor, or MAOI, or if you are allergic to anything in Ritalin. Ritalin should not be used in children less than 6 years old because it has not been studied in this age group. Tell your doctor about all the medicines that you or your child takes, including prescription and non-prescription medicines, vitamins, and herbal supplements. Ritalin and some medicines may interact with each other and cause serious side effects. Sometimes the dose of other medicines will need to be adjusted while taking Ritalin. Your doctor will decide whether Ritalin can be taken with other medicines. Especially tell your doctor if you or your child takes antidepressant medicines, including MAOIs, seizure medicines, blood thinner medicines, blood pressure medicines, cold or allergy medicines that contain decongestants. Serious adverse reactions to Ritalin can be heart-related problems, mental problems, or circulation problems in the fingers and toes. Other common side effects include headache, decreased appetite, stomachache, nervousness, trouble sleeping, and nausea.
Mechanism of action. Methylphenidate inhibits the reuptake of norepinephrine and dopamine. It also modulates the activity of DAT and NAT. Dopamine transporter DAT influences the synaptic concentrations of dopamine, whereas the norepinephrine transporter, NAT, is in charge of norepinephrine reuptake from the synaptic space to presynaptic neurons. Pharmacokinetics. The methylphenidate taken orally has a bioavailability of 11 to 52% with a duration of peak action around 2 to 4 hours for instant release, and it's 8 to 12 hours for extended release. Advantages would be that it may be useful when a top-up of the once daily dosing is required, or it may offer more flexibility. A couple of disadvantages would be that the shorter duration than long-acting versions, and it may be prone to having peak or trough effects that may be uncomfortable. Time to initial effect takes about 20 to 60 minutes, whereas the duration of action remains in 3 to 5 hours time frame. This is the optimal time to stay within the moderate release to stay alert, as opposed into being fatigued or stressed where you have either too little dopamine or norepinephrine, or stressed where you have excessive amounts of either. A few special considerations to take account for when taking Ritalin is that some dosages are lower than others to prevent potential abuse, and that's why doctors only increase it by increments of 5 milligrams. Any experience of euphoria may indicate abuse. Secondly, results are often observed immediately, but finding the ideal dosage amount and frequency may take from several days to a few weeks. This is a process of trial and error, because studies so far have failed to correlate body weight, dosage size, and the blood levels of the drug to a reliable clinical response. Thirdly, a 3-day time frame is optimal to allow for precise determination of the medication's effect. The causes of behavior are complex, and it's difficult to attribute to anyone's day's good or bad behavior to a drug. 3 days of consistent results make it more likely that the medication is responsible. Lastly, dosage varies for each individual based on caloric intake, amount of activity level, body weight, and etc. PT implications of drug. It is time sensitive, so if a patient is on Ritalin, patient should be attending PT while the prescription is at its peak to be the most productive or efficient. This would be in the second or fourth hour of its effect. Increased hunger towards the last hour of effect may occur, and after the dose loses its effect, patient will feel sluggish. Patient may have increased irritability, so proceed with caution. Mood swings might be apparent, and this can come from sleep deprivation. Patient may also experience abdominal distress, so we should be careful with therapeutic exercises. And patients may experience rebound effect from the drug during the session. Taking Ritalin without a prescription may actually change the brain chemistry with abusing it. So we found that college students take it to help them study, and they are twice as likely to misuse prescription stimulants than any other age groups. We saw that changes in the brain chemistry in ways that are known to have an impact on the reward pathway, locomotor activity, and other behaviors, as well as effects on the body weight. These changes in brain chemistry were associated with serious concerns such as risk-taking behaviors, disruptions in the sleep and wake cycle, and problematic weight loss, as well as resulting in increased activity and anti-anxiety and antidepressive effects. Further research indicated that female subjects were more sensitive to the behavioral effects of methylphenidate than the males. Another research that we found was that Ritalin and cocaine are comparable. Ritalin is a stimulant like cocaine. It may cause undesirable changes in the brain over time, as we mentioned before. It also has the potential for abuse, and because it is a legal prescription drug, many wrongly assume that it is not dangerous. Ritalin is a powerful stimulant that increases alertness and productivity like cocaine. Ritalin and cocaine also look and act very much alike. They have a similar chemical structure and both increase dopamine and norepinephrine levels in the brain, as we mentioned earlier in the presentation. They do this by blocking a dopamine transporter protein, which normally takes up dopamine from the synapse. With that said, ADHD children are typically taken off Ritalin when they reach adulthood. Interestingly enough, these individuals seem to be more prone to cocaine addiction. This is because Ritalin and cocaine are similar drugs. It's possible that ADHD adults are unknowingly using cocaine as a replacement for Ritalin. In other words, it may be an attempt to self-medicate, and it may help individuals with ADHD focus and feel calm and in control. Ritalin is not addictive when prescribed by your doctors and taken as directed. It is a pill that you swallow, so the drugs take longer to reach the brain. Cocaine, on the other hand, is taken in high doses by injection or snorting. It floods the brain quickly with dopamine, which makes it dangerous and addictive.